Welcome to Future Talk. This is the program that examines the global impact of technology, both for good and for bad, and tries to see just where the new technology is leading us. On today's program, we're going to talk about a new approach to healthcare, sometimes called Health 2.0. It's about using internet technology and social networking websites to enable people to be better informed about their own health conditions and more active participants in their own health treatment. I have two guests. Thomas Goetz is executive editor of Wired magazine and author of the new book, The Decision Tree, Taking Control of Your Health in the New Era of Personalized Medicine. Jennifer McCabe is co-founder and CEO of Contagion Health, which is a software company that creates social networking tools to help people with similar health goals share their experiences and ideas. Jennifer, what exactly does your company, Contagion Health, actually do?
So Contagion Health builds social applications that allow people to share healthier behaviors online. So we use Twitter and Facebook and your existing relationships to motivate you. We have a challenge application called Get Up and Move, which is at http://getupandmove.me, that lets you challenge friends and family to small acts of fun fitness activities, like I will do 50 bed jumps if Thomas will make a snow angel, or I will dance to 2 songs if you will run for 5 minutes.
Now, I understand that we have a video that shows some of the motivation that you had for getting into this work. It's an excerpt from a speech you gave in Boulder, Colorado a couple of years ago. We're going to show that video and then come back and discuss more of your work. So let's go ahead and roll that tape.
To improving healthcare. Addicted, absolutely, obsessively. And everything that I do is about connecting people who might actually be able to help me get that done. If you look like you do something useful, I want you to start fires with us. No, actually, this is what's happening to healthcare in the US right now. Okay, so it's a series of escalating events leading to combustion and epic fallout, right? That's pretty scary. But I'm one of those people who believes that we haven't reached mutually assured destruction yet, but we will. So why should you care? Most of you probably don't need health care. We need you more than you need us. But the good news and the bad news is that at some point you will be a patient. You will need health care. And at that point, it doesn't really matter what you do. It doesn't matter how many followers you have on Twitter, how many businesses you've successfully exited from, right? You need an anchor. You need something that's going to help you weigh in the system. So this is my story. I'm here from the patient perspective. I'm not a doctor. I'm not a nurse. I'm a crazy healthcare person. 8 years ago, I fell asleep at the wheel and hit one of those anchors dead on, crushed my right knee and ankle. Doing great. But I realized that I know more about my body and what works for me and what doesn't than my doctors do. I am now a hyper specialist in my condition. Well, good, maybe. I know I can do some crazy things. Bad because there's no way to communicate with my provider, with my doctor, the hard freaking won, subjective personal knowledge about my health care that I need to have a two-way conversation with them about where I'm going next.
So you got into this work largely because of your own health experience. You smashed up your leg in an auto accident.
Yeah.
Now, if the social networking tools you're working on now had been available then, how would they have helped you?
That's a great question. When I first got hurt and had my initial surgeries in Maryland, the only thing that was available for patients on the web, this was 2000, were listservs and resources for doctors and medical students. And this was in very complicated professional language. So even as a relatively educated person, it was difficult for me to find information that was valuable. But there was a site called mybrokenleg.com, which is still available, that patients that had really grisly kind of leg injuries were sharing what worked for them in physical therapy, what kind of clothes they could wear, how they recovered after surgery when they had bowel issues or these other really embarrassing things that your doctors don't talk to you about. And that was just a kind of information list that was static, where you put something up and someone had to find it using a search engine. Now the social networking tools are absolutely amazing. In real time, I can find people that have the same condition that are sharing all of this important knowledge about what works for them and what doesn't. It would have changed my mood and perspective. It would have changed what I thought was possible for someone with my condition.
Mm-hmm. So now in your company, do you create your own platforms for social networking, or do you basically build on platforms that are already there?
It's a great question. So at Contagion Health, we believe that even though illness is viral, healthy behaviors and healthy information can be contagious too. one of the differences between the way that we work and the way that other companies and organizations work is that we believe your existing relationships are the most important thing to learn from. So we tap into existing social networks that you already use, Twitter and Facebook. Rather than creating another isolated community of people who are ill, we let you connect with people who are healthy as well to provide the motivation and support you need.
Now, your Get Up and Move program, that's on Twitter. We actually have some slides to illustrate that.
Oh, good.
Maybe we could show those slides. We have a series of slides that show some of the Twitter pages, which will be coming up momentarily. So now how does this work? Someone sends a tweet that says, if you do 10 push-ups, I'll run around the block.
Yeah, so you can see some here now. One of the things that we do is we've found that we have people all over the world using Get Up and Move. And the way that people talk about using Get Up and Move on Twitter is to use that thing that looks like a number sign. And you see, yeah, you see Get Up and Move all together. That's called a hashtag. And on Twitter, it's like a code word. It lets people opt into a system and let them know that other people are doing the same thing or they're at the same event.
So with a hashtag, by putting that hashtag in your tweet, then anyone can search on that hashtag and find all the tweets that contain that hashtag.
That's exactly right, Marty. So you not only can work with people that you already know, but you can find new people to work out with using the Get Up and Move hashtag.
Now, we also have platforms like Facebook, and anybody could start a group on Facebook and say, this Facebook page is dedicated to a certain disease. Is that adequate in itself, or do you propose to add new features and build upon that to make it more useful?
I'm biased, but I don't think that that's adequate in and of itself. When we start talking to people who have serious conditions, you find that even among those people, illness is not the sum and total of their identity. So a condition or disease-specific network that just focuses on the part of you that's ill, I don't think helps you determine what you do when you're not in the hospital. It doesn't help you live in a healthier way with the daily decisions that you make. And that's what we want to do. So that's what we enable. We make sure that if you're going to challenge someone using a Contagion Health application like Get Up and Move, someone else has to complete that challenge too. You have to motivate not only yourself, but someone else to a healthier behavior.
Let's take a specific example. Let's say that someone has some kind of lump that might be cancerous, and they'd say, I'd really like to connect with other people who are having a similar condition so I can learn about their experiences, learn what they did. Is there any site they can go to now that will provide that for them?
Interesting. So there are lots of sites that you can search for the things that are of concern to you. Google, other search engines will let you say things like, I have a lump in my neck, and try to find those resources. But we find that those resources are generally provided by doctors and hospitals. And if you want the specific shared experience of someone who is going through the same thing, you want to go to where they're already talking about that condition, and that tends to be an existing social network, like Twitter or Facebook. In particular, we find that people, when they're pre-diagnosis or first diagnosed, that they continue to use those whole social networks rather than ones that are condition-specific.
Thomas, you just wrote a book called The Decision Tree. In fact, I think we have a slide that shows what it looked like. What inspired you to write that?
So I've been a journalist for a long time, about 15, almost 20 years. And I come from a family, though, of healthcare providers. So I have the proverbial dad who's a doctor, mom who's a nurse, et cetera. So it was always interesting to me, the idea of healthcare and kind of how do we find our way and make our decisions and make kind of good health for ourselves. What I found in writing the book, though, was that there was an opportunity to engage some of the tools of technology that we write about at Wired Magazine, along with some of the principles of good public health that I had exposed myself to at Berkeley, getting a master's of public health. So the opportunity was to bring these two worlds together, to bring the ideas from the world of public health together with the tools that Jen is talking about in the internet and information technology, bring them together and really create what hopefully is exponential change.
Now, we have a video which I think was produced by you, which illustrates some of the ideas in the book. So we're going to show that video, then come back and discuss the book further. So let's go ahead and roll that tape. that brief video displayed some of the issues raised in your book, The Decision Tree. Now, what does the book actually tell people? Does it give you a step-by-step procedure about what to do if you have a particular health problem?
No, it's not diagnostic or therapeutic at all. What it tries to do is present this new mode of engagement. You know, a lot of us, when we think about our health, it's a source of anxiety, it's a source of worry, it's a source of fear, and we tend to try to kind of push it aside and not worry about it, not think about it until something goes wrong. And then that's when we kind of have an interchange with our doctor or the healthcare system. And oftentimes that's reactive, right? That's a reactive system. And it really doesn't create optimal health. And I think what Jen's working on at Contagion and what I'm trying to get across is this idea that when people actually take some control and have an opportunity to engage, their health becomes a positive thing. And that's what the video was talking about, is a feedback loop. When you're starting to work positive inputs into the system, into the way we think about our health and the choices we make, you can actually come away feeling pretty good about your health.
Now, when we talk about a decision tree, is that something that the individual does by himself or herself? Does it involve a doctor? Is it like a flow chart?
Well, so yeah, a decision tree is another word for it, is a flow chart. And what I mean by that is the decision tree is a structure or a trope, if you will, of basically active conscious decision making. So a lot of us make decisions constantly all day about our health, but we don't really think of them. They're kind of the things that we think about in the back of our minds. And as Jen makes the good point about these are micro choices. These are often little tiny choices, little decisions that we make that add up kind of in aggregate, in sequence, to become our health. And the more we are conscious of those decisions, the more we're aware of those opportunities to make better choices, the better our health will be.
Well, one of the typical choices might be, well, let's say I have a pain somewhere. Should I go see a doctor or should I ignore it? Would your decision tree help you make that decision?
Well, I think that one's pretty easy. That one, I'd go to the doctor with that one.
Well, it depends how bad the pain is, I suppose.
Yeah.
And then if the doctor tells me to take certain medication, should I take it or not? Maybe he's not really sure.
Well, right, and so one of the opportunities that all this information that's becoming available online and that we can actually personalize is to augment the conversations that we're having with our doctors or our care providers, so that they're not our sole source of information. You know, I think there's a lot of enthusiasm for the health information that's online, but we need to make sure that that's good information, that's relevant information first and foremost to our own circumstances. And to me, that's really what personalized medicine is. It's matching up the known research with our specific circumstances.
Now, in your job at Wired magazine, you're considered a trend spotter. Your job is to look for trends. Mm-hmm. Would you say that this type of personalized medicine is an important trend that's going to grow in strength?
I think it's a huge trend. It's if you ask me, it's a tidal wave. It's a new shift in the way we deliver healthcare and what we expect of our society and the members of our society. I think a lot of the conversation that's going on around healthcare right now is very much a top-down one, trying to have the government create coverage for everybody and whether or not that's the role of the government. That's a good and necessary debate, but there's another side to that. Individuals need to get engaged and need to take responsibility and start taking some action, and that's a very real thing that we need to do to improve the way we deliver health and to improve our nation's health.
Do most people want to learn more about medicine? You know, some people have the attitude that I want the doctor to make all the decisions. That's what I'm paying him for. He's the one who went to medical school. And medicine is the sort of thing where, a little bit of knowledge can be dangerous.
Yeah, well, certainly that is anybody's right? If you want to put your head in the sand, that's fine. The easiest way, the most simple way to engage in your health is not to think about it at all. So what we're suggesting in the whole idea of Health 2.0, it's more complicated. It's going to be a little more tricky. But the opportunity, the upside here is huge, right? The upside is better health, better life.
Can you give a specific example of how somebody might use your book in order to deal with an issue that they have health-wise?
Well, again, I'm not providing specific remedies, but what I'm hoping that the book does is it helps people understand that they have options and that there are ways that they can insert themselves into their own health care and their own health choices. Now, it's not all cut and dried. It's not going to be easy, as I say. But I think there are ways of engagement that really are quite powerful and quite positive.
Okay. Now, I have some questions that either of you could answer. For example, the healthcare system in this country is near collapse. Costs are totally out of control. is this internet social networking thing where people have better communications, does that ultimately do anything to address the heart of the problem, which is that the whole system is severely mismanaged? Will this sort of open communication help that?
I think so, absolutely. The shared management that is enabled by these sorts of technologies, by the web, by me having a mobile phone where I choose the applications that are relevant, where I can track how much I move, whether or not I take my medications, whether or not I'm having that pain in my neck, and should I see a doctor, should I find a hospital closest to me. This is giving us a new platform for choice and a feeling of control over our decisions on a daily basis. And then, once we get used to that kind of behavioral pattern of using decision trees, when something happens to us, God forbid, and we have to go into the hospital, we think automatically, yeah, why can't I use this? Why don't I have these choices? Why can't I access the web in hospitals? Why is that blocked? Why can't I get support to feel better from my friends on Twitter and Facebook in this setting? So I think we're headed that way, absolutely. And as Thomas said, it's going to be a tsunami when it gets here.
Do you think we need total new paradigms in the way healthcare is delivered in this country? Right now we have the paradigm that, the body is basically a machine, and if a part wears out or breaks, you get it fixed. There's not much emphasis on prevention. There's not much emphasis on the mental aspect of health, whether your mental state affects your immune response. Is that something that urgently needs to be developed more?
Yeah, I think those things that you mentioned, and I think the other thing that's essential is that the patient be given a role, and oftentimes be given the role of central decision maker. It's rather onerous to get our health information right now. To get results from our tests, for instance, if you go in and you get blood work, you have to ask oftentimes for your doctor to have the lab send you a copy of the report. That should be the default mode. We need to really shift the way we think about the patient's role in their healthcare. The patient oftentimes, the individual, oftentimes knows more about their health than even the doctor because they're the ones who are living with it every day. The opportunity is to extract that information and extract that expertise that we all have about ourselves.
Now, in the social networking sites that you're working on, would the doctors be a part of it also? So, for example, if I were under medical treatment for something and something changed, instead of having to wait for an appointment, I could just put a little message somewhere, which the doctor would have to look at because that's part of his job, and I could get a response without having to schedule a formal appointment.
That's trickier. I think there are several hopeful developments in medicine, in patient engagement, and in social health care that lead to some promise for that eventually being the case. Currently, one of the most promising developments that I see is that doctors and patients who aren't involved in the care process together are interacting on social networks. So we're already seeing patients, nurses, and doctors talking about general health issues. Now, doctors can't prescribe care via Twitter yet, but I'm hopeful that someday soon we'll find a way to pay doctors to interact with me on the web, through email, through text messaging, through things like telecare provided by Health 2.0 companies like American Well, and that when we incentivize doctors to interact with us in a safe and effective and clinically legitimate way, and when we incentivize patients and make it easy for people who are patients to use those channels to send this body of experiential knowledge that we generate every day back to our doctors, that's when we'll have true Health 2.0, true participatory medicine where patients and doctors are partners in care. And I think that's many people's ideal.
Right. And right now there's a problem with access.
Absolutely.
If you go to the doctor and he recommends something and you leave his office and you say, did he tell me to take 1 pill a day or 2? I can't remember. And I forgot to ask him that question I had. Yeah. It's hard to get back to him.
It's true.
Yeah, and there's some efforts to provide that information automatically. So the Robert Wood Johnson Foundation has this great program that's called the Open Notes Initiative. And they're trying to make that the default mode, where when the doctor gives you advice, not just a prescription, but the general advice, that is written down and communicated. And that those are what should be very basic exchanges of information. But the fact is we need to put those into mandated procedures.
Now, there's a big issue in this country. It's a very big political issue about who's going to pay for health care and how much health care should be. Do you think that health care should be considered a right where everybody is entitled to receive whatever health care they need, whether they can afford to pay for it or not, or whether their insurance company is willing to pay for it or not?
Right. Well, so my personal opinion is that yes, I believe that health care is a universal right and that access should be provided to all citizens. Now, I don't necessarily expect that to happen. As we've seen over the last year of the legislative effort to get that principle or part of that principle turned into law, that may or may not happen. I think the other component, though, the other essential component of healthcare reform or health reform is getting the patients involved and getting the patient to start making actions that can address some of these systemic concerns that we have with too much chronic disease, too much of our costs going to care for chronic disease. We can be changing those things on our own at the bottom grassroots level.
One of the expensive aspects of the healthcare is testing, and this is judgment call. I mean, you could always get one more test. Tests are very expensive. So do you think having this open communication would lead to more realistic results as far as, well, how much testing should you give to a person? Does it only depend on how good his insurance is? Or should there be some kind of standard, like, I mean, we're not all going to live forever, no matter what you do. You know, it's going to end one way or another. So should we be making desperate attempts to give every test possible, providing somebody is going to pay for it?
There are only two certainties in life, no matter what kind of insurance coverage you have. And one is that you're born, congratulations, happy birthday. And the other is you're going to march along life and at some point you're going to die. I'm sorry. And in between is where we have so much opportunity to optimize not just the care that we're talking about that's highly episodic when something goes wrong, but the life decisions that we make over time. And I think right now tests are snapshots. They're like fossils. They're one glimpse into something that happened to us and we're looking at the body's results. When we can put into context the decisions that a person is making over time and then add the additional information granted by these tests, I think we'll test less, we'll use the patient's information more, and we'll save not only that person and their doctor time and insurance coverage money, but also the system as a whole. Because health is individual before it's exponential. We have to improve the personal standard of care and the personal standard of living before we improve a population or community's use. So if what we want to do is reduce tests over time because they cost a lot of money for the system, we have to reduce the individual's use of testing. And I don't think we'll be able to do that until we have more information about how people make decisions.
Do you think that social networking tools also help a lot with medical research because doctors can share their results much quicker? Right now, if you develop a new drug, it takes years to go through all the approvals, and there are a lot of restrictions because society has become very risk averse.
Right.
We don't want anyone to take any risks, and that's expensive, avoiding all risk.
Yeah. So there are. So I don't know actually if your networks actually do kind of patient research or aggregated research, but there are 23andMe is a company that's doing aggregated patient research. Patients Like Me is doing aggregated patient research. It gets a little more complicated when you talk about doing drug clinical trials with those kind of ad hoc research groups. So far, the FDA hasn't figured out how to take advantage of that. But the traditional system, what we know is that the traditional system that we have for doing research is slow and laborious, and it doesn't have to be.
And inefficient, and too expensive. And what we have, if we look at people as an asset, and the data that they're already sharing on social networks, there is a huge body of data out there that can be used for more efficient research about how to improve our health. We're not tapping into it except in very limited exploratory ways currently. So there's a lot of promise for communities like Cure Together.
Yeah, and this is the way data is reshaping all sorts of industries, right? So this is the way data is reshaping everything from manufacturing to retailing. Yeah. Data is correlations are emerging out of the data rather than the data being gathered to try to get at various hypotheses. Yeah. And that's what we have the opportunity to do with healthcare now.
I would think that you could also detect patterns of disease much more easily.
That's exactly it.
If there's a cluster or high incidence of a certain ailment in a certain location, it would be easier to spot that, and then you could figure out what the cause of that was.
Absolutely. Yep. Pattern recognition over time. And if my Netflix account can tell me that I like romantic comedies with strong female leads, why can't my hospital information, you do too, Tom. Why can't my hospital information tell my doctor that over time I don't like to take prescription medications, that I would rather use alternative methods of treatment, and they should talk to me about those options first? It's just ridiculous. We have the technology. We just need to change the culture.
Well, it sounds like the internet is a boon to almost any kind of human activity. It makes information so much easier to get to. It really makes possible all kinds of things that you just couldn't do before.
It's just another channel for content and community.
Okay. Absolutely. There's lots more I could ask you, but I've just got the signal that we're almost out of time. So we are going to have to wrap the show. I'd like to thank my two guests, Jennifer McCabe and Thomas Goetz. Thank both of you for being here. It was a pleasure having you.
Thank you, Marty.
I'm Marty Wasserman. Thank you for watching. Be sure to tune in again next time. Also, please visit our website at www.futuretalk.net. See you again next time.